Hey, what's going on? This is Coach Selby here. I just wanted to continue on the theme of about the knee. And I found a local basketball court here in Hawaii, which is quite unique. It's a big old barn. And I guess it protects from the wind. It's quite an interesting little basketball court, but it works. So anyway, I got some responses about why your knee hurts. So I kind of wanted to go into a little deeper. What do you do to start healing your knee? When I work with clients one-on-one, or when they take my program, they learn in detail exactly what they're working with the knee. One thing I would suggest is that you really start diving into anatomy books and understanding the muscles that are at play. You got muscles on the front of your body and muscles on the back of the body. And so what that means is they all got to be cooperating. And if they're not cooperating, you're going to be in pain. And then the other piece is what makes ACL tears and all of these tears, like I said in the last video, is that the muscles aren't strong enough, so when you do a cut, the ligaments have to respond instead of the muscles being able to provide the strength and the flexibility. Now it also, again, relates to the hip, the knee, and the ankle. So if the hip makes a cut and the ankle isn't open enough, the knee has got to take the brunt. If the hip and knee aren't open enough, then the ankle's going to take it. So they all work together, and it's important that you really understand how that works. So in order to start healing, it's vital that you understand you got all of these muscles that are coming down and affecting the knee. These are all on the front of the muscle, front of the leg. And then you have muscles that come on the inside of the leg. Okay? Those are major players. These are anterior muscles. Then you have posterior muscles, which means on the back. So then you look at the back of the muscles, gluteals, those are up in the hips, and I'll talk about that again. Then you got the hamstrings. Okay? And look, they all attach below the knee. So it's vital to understand that these muscles are important. And if you don't know how they work, you can't absolutely begin to heal them. So some of the things that I would encourage, if you just had a surgery and you did PT and your knee's still sore, you got to learn how to get in there and start. It's called sensory motor. You got to develop a sensory motor attachment because you've lost touch with the muscles in there, and so that's what makes athletes afraid to run and cut as hard as they used to. Brandon Roy is a good example. He's still trying to find his rhythm, but his knees won't allow him, so he's got to really do some soul searching, and he's got to do some really deep work on his muscles this summer if he wants to play like he's been playing. Some of the things that I would suggest is being able to get the knee fully straight. A lot of people can't straighten out the knee all the way. So they walk around like that all the time. So one thing we want to do is learn how to get the knee fully straight. That's the last 10-degree art. And so when I talk to people, we get into detail about exactly what needs to be done in order to do that. And then the other thing is to be able to really begin to bend the knee. Because we got to create space in here. Really begin to bend the knee. Okay? If you can't bend the knee, that basically is telling me that these ligaments are short in here. These muscles in here are tight. Okay? And then the quadriceps, the hamstrings back here may have some tightness. So the knee is a very complex joint, is my point. And it requires the person that has the knee problem to really begin to do your own homework. I mean, if I was a surgeon and I cut you and pulled out the ligaments and cleaned out your knee, I'd done my job. As a stretch expert, my role is to teach you how to begin to increase the blood flow and range of motion again to those joints, because that's the only way that you really are going to heal and get back to normal. And then the second thing I would do is begin to help you deal with sensory motor comprehension. You got to get to feeling what it feels like to be in your knee and then being able to move it so that it can get strong again. So anyway, I'm going to go finish checking out this crazy basketball court, and I'm going to see if I can get the rim. Later.